Good morning. It is the 1st of April 2019. Thank you for joining us today. Good cooperation between the Department of National Security and the UN Office on Drugs and Crime. District plans presented. Vaccination is important for good health and investments to be made to improve healthcare in the districts and also in the interior. Cooperation in the fight against drugs between the United Nations Office on Drugs and Crime, UNODC, and the National Security Department is good. The achieved results since 2013 were presented last Friday. Daniela Feira, the director of the National Security Department, says that with this cooperation, it is emphasized that Suriname is taking the international fight against drugs very seriously. The major drug seizures last year would have been the result of a closer cooperation with the UNODC. According to Bob van den Berg, the regional coordinator for Latin America and the Caribbean of the UNODC, Suriname has proven to be a good partner in the fight against drugs. He further indicated that Suriname is not on any blacklist for drug trafficking. Last Friday, at the Ministry of Regional Development, the district plans for 2020 were presented to Minister Edgar Dikan. These plans stem from the hearings held in the resorts of the various districts. Minister Dikan says that with the presentation of these district plans, the importance of participating in hearings is proven. During the presentation of the plans, the district commissioners briefly highlighted what is included in the documents. In most districts, attention has been requested for power supply and clearing the roadside and creeks. The budgets associated with these plans will, according to the law on the decentralization, submitted after 2 months to Minister Dikan. Minister Antoine Elias of Public Health stressed the importance of having a good health. Eating healthy food, such as fruit and vegetables, is very important, but also the vaccination of babies and toddlers against diseases such as whooping cough, diphtheria, and measles is indispensable. Through these vaccinations, children are made resistant to diseases that can have adverse effects on their bodies and their further development. In the United States of America, there has recently been an outbreak of measles. Minister Elias indicated that the ministry is prepared should an outbreak of measles occur in Suriname. In the U.S., children who are not vaccinated are temporarily banned from public places, including schools, parks, and also shopping malls. Parents in Suriname are also obliged to vaccinate their children, otherwise they cannot be enrolled in schools. And in our last item, the government will make a substantial investment to improve the quality of the healthcare in the districts and also in the interior. This was emphasized by Minister Antoine Elias of Public Health. To have a good orientation of the current health situation in those areas, Minister Elias is more often in the interior and in the various districts. Soon, representatives from the Medical Mission, the Office of the First Lady, and also from the Ministry of Health will visit Achoni. The Ministry of Health recently visited the villages that are in the Wayambo area. The First Lady was also present. During this visit, insurance cards were handed over to the local communities. That is all we have for the local news for today. Have a wonderful day further. Bye-bye.